Let's talk about schizophrenia with leading psychiatrist.
Hello everyone. I'm Dr. Anand, consultant psychiatrist in Government Hospital Erode and Sudha Institute of Medical Sciences in Erode. Today we are going to speak about the link between schizophrenia and social anxiety, and what is the importance of social anxiety and why we have to manage this in case of treating schizophrenia. We will begin with a study. In a study published in AJP 2004, it shows 36.3% of schizophrenia patients have comorbid social anxiety disorder. Study also speaks about the content of the social anxiety also. We'll look one by one. The first example, in a person with positive symptoms, like in case of referential delusions, anxiety is more due to the people surrounding are aware of my abnormality rather than fear due to the dangerousness of the person's surrounding. It shows the social anxieties due to the positive symptoms per se is less than the social anxiety. It shows social anxiety is separate symptom and separate disorder associated with this. The example 2, it is in another domain, the thought broadcasting. The fear of disclosure of my illness is more than the fear of losing privacy. We know how social anxiety disorder and its contents vary with patient to patients with schizophrenia. It is present in 36.3, but the content is varying. The another study, in a naturalistic study, it is a longitudinal one comprising more than 200 patients in 2020. It shows impacts of changes in social anxiety on social functioning and quality of life in outpatients with schizophrenia. That means the treatments targeting social anxiety seems to be the keys of achieving the full recovery. With schizophrenia, social anxiety may pose great problems in patients who predominantly express negative problems. When treatment strategies for schizophrenia are formulated, treatment of social anxiety should be considered. Relative to other individuals without anxiety, socially anxious persons tend to disclose less information to others, recall less information about social interactions, and have lower expectations regarding their ability to execute self-presentational behaviors and generate more negative self-statements. It is at most important. If the symptoms of social phobic symptoms remain unrecognized and untreated, they get associated with more severe symptoms of psychosis and even lower self-esteem. So both of the studies which I mentioned above shows the same. The first one is psychotherapy for both the patient and the family person. It includes skill training, helps to focus on work and social skills, grooming and self-care, and other day-to-day activities like money handling, managing household chores, interactions with the neighbors, and psychosocial interventions such as psychotic patients and their family include working with social anxiety symptomatology with the work on reducing the self-stigma and increasing self-esteem, training of the communication skills, problem solving is at most important, which could help to increase the quality of life in our patients. You can manage both the conditions well, the primary schizophrenia or psychosis symptoms and social anxiety disorder, if you start the treatment as soon as possible, which can help you ease and avoid frequent relapses and frequent hospitalizations. And for patient side, it will help cut the disruptions in patient's life, family, and friendships, improving the lifestyle. Thank you.